Am I live? Yeah. I'm here trying to check if these are gonna work well. Mm, okay, I think it's going to work. Now I am just waiting here for everyone to catch me up, be here, I'd say. I'm using my mobile to check because I cannot see what's going on in the screen, so I'm checking in my mobile if it's working fine. Okay, I see one view, but I don't know who that is. Wait, is hello. Two views, hello, welcome. My last time there were 5 views, so I'll wait for at least 5 views today as well. And once we have 5 viewers, I think I'll get started. And today I did manage to share my screen here as well, so yeah, I hope it is gonna get better. I am a little bit nervous though. Again, back to one views. I've still got 5 more minutes though, so let's wait. And please do share with your friends and family so that more people could join us here today. Do you advise on antidepressant? Rambo John. You mean medicines? Antidepressant medicines? If you're talking about antidepressant medicines, yes, I do recommend taking medicines, but yeah, you need to be careful on what you're taking. In many cases, like you take medicines for blood pressure and even when you get fever, so why not for your mental health, right? Uh, like people are scared. I'll be talking about this again in my presentation, but yeah, people are scared that if you take medicines you'll just get addicted to it, or there are many side effects on antidepressants and medicines. I mean the antidepressant pills, but um, like those are kind of chemicals. If you are feeling really low, those are the chemicals that could help you feel a little better. For example, when you are really stressed, those medicines help you lessen your stress and make you feel a little better. But at the same time, when you're taking medicines, you have to go through counselings and therapies too. You cannot just rely on medicines. I don't. Is that the question you asked me? And if I answered it well, please do respond. It would help me a lot. Rambo John. Mm, one of my friend always say he is on depression, so I don't know what to say and what I can do. So the first thing, like as a human, I mean, as a normal friend, what we can do is always listen to what they are saying, instead of trying to recommend, do this or that. In a lot of cases, the best thing would be just to listen to them and try to understand, not by judging or questioning them. um, like just listen. In a lot of cases, people just want them to be heard and feel that they are being heard. So that's the first thing you can do for now. And then if you could take him for counseling sessions, like um, try to make him understand that counseling helps a lot, then that also helps. And like there are different ways where a counselor would dig deep into his problem. And yeah, I think a specialist would know more. Like we could talk. um, if you want, I could you could recommend talking. Like we could sit on a session and we could talk so that we could know what's really going on with him. But yeah, as a friend, what you can do is only listen to him and just understand what he's going through. Not, yeah, just be an ear for him. Okay, so it's already 7 and I think we should get started. Um, and I will answer some of your questions later on as well. So, yeah, thank you for your questions. Okay, so this is my slide. Okay, so once again, welcome to everyone. Today we are here for a psychosocial well-being awareness program. This awareness program is a part of 6 months psychosocial counselor training organized by Abbal We Foundation under CTEVT. And today I am here, Upalavana Shake, as your host or presenter. Yeah, and here we are here on our anti-depression mental health page. This page I made a few months or years back. I think it's already a year, few years back, so that I could help aware people about mental health issues. And as now I'm doing my psychosocial counselor training, I got to know that in many cases the psychosocial issues affect our mental health. So I'm just trying to use this platform as a way to share awareness on psychosocial issues, what is psychosocial well-being, and try to understand psychosocial well-being, try to understand the causes and effects of psychosocial issues, understand management of psychosocial issues, understand the management technique for psychosocial issues, and also understand the benefits of counseling in psychosocial issues. So what is psychosocial well-being? So what basically is psychosocial? So psychosocial is a two term, psycho and social, right? So psychology and society. So as an individual, there's an internal environment of one individual, which consists of psychology, emotions, how people think, how people respond to a situation, how they how they feel good or bad, what are the ways, what are the things that they take in consideration for um, making any decisions. And then there is a society where they live in, the cultures, the norms that they have. So when the internal environment of an individual and the external environment of the individual interact constantly, they produce a psychosocial behavior. So I would say a person is well, or is in a is in a good relation with both the internal and external environment, they produce a they show a very peaceful nature, or they are in peace with their internal and external environment. But then there could be a situation when their internal environment is in conflict with the external environment, when their internal norms do not match with the external norms. In that case, there is a clash between between the two environment, and because of that, there are different issues in their psychological behavior, and that produces lots of psychosocial issues. So like I said, if you could see here, there's a person, and then there's social, spiritual, emotional development, physical development, cognitive development, and they all are affected by the family they live in, the community they are in, and the culture or society they are in. Now again, if you consider of a person who lives in a house, he is like comparatively in protection, and that's the protective factor, because he is now safe from the extreme wind, temperature, hot temperature, cold weather, maybe rain, or even from different animals, maybe being attacked from different animals, theft, robbery, etc. So the things that he's protected from is the risk factors. So the animals, they are the risk factors. The extreme temperature or the climate weather is the risk factors, where if it's a good weather, it's obviously a protective factor. But if it's in if he's exposed to such extreme environment, then that's the risk factors. So just like that, in a psychosocial environment too, there are some risk factors and protective factors. So if first I'll talk about the protective factors. For example, you have a very supportive family who understands you. You're very good. You get along with your friends, co-workers, and you do have learned some coping skills. Like, if this happened, I'll do this. You have a backup plan for everything, and you constantly take consultation with mentors or seniors. So you have a positive thought, and you kind of know what you're going through and what you're going to do with your life. Then that's kind of protective factor. But then there are risk factors, like first, obviously, the opposite of what I told in the protective factors are risk factors already, but then we have gender issues, or like gender inequality. So this is very common, and maybe people are gonna say, I'm gonna talk about gender inequality and how, women are in trouble. But at the same time, yes, I am a feminist, but at the same time, there are men too who are being in trouble because of so-called gender issues. Where, for example, society norm, the social norm is men cannot cry, but then men also have emotions. Men are human being too. They too have emotions, so they are allowed to cry. But but because this culture and this society does not accept that men can cry, um, they could have a problem expressing themselves, and that could lead to the reactions like maybe less confidence. Maybe they are suffering. For example, a guy is married, and then he now is in between two women, that is his mother and his wife. Now if he's a little bit inclined to his mother, maybe his wife's gonna say, you don't take care of me, I left everything for you. Because in our society, in most of the society, the um, woman is supposed to um, leave everything and stay with husband. So now the wife is gonna say, I left all my family or everything for you, and now you just listen to your mom, you do not listen to me. And so so he's in trouble, right, like he if he does not understand that. Or in the other way around, if he's just a little bit more inclined to his wife, if he just supports his wife, then there is a possibility that the mother is not going to like it, and mother's going to say, oh, I gave you birth, I took you, I mean, I carried you for 9 months, I gave you all the educations, everything, and you just listen to your wife, you do not listen to me. So now he is again in trouble. But then this trouble is because of the society, because the society has created the norm that first, men cannot cry, men cannot show emotions. Second, two women do not get along. Third, a daughter and a daughter-in-law are not equal, and also a mother and a mother-in-law are not equal. These are like very less to be seen in our society, because they just, I mean, it's not that they cannot be equal, but because the society, if by any chance a mother-in-law takes care of her daughter-in-law as equal to her daughter, then the society would say, oh, you've make sure you I mean, your daughter-in-law is not going to take over you or do something. Like, people do not take it in normal way. So all those are like the risk factors. Because of the society, our behavior are affected. Similarly, now for gender violence or domestic violence, more than gender violence, I would say domestic violence. Suppose a guy is beaten up. I mean, it could happen. If a guy gets beaten up by his wife, then the society is gonna say, oh, what kind of guy you are, you cannot just handle your woman or take care of your woman, or just say like, you're so weak that you cannot put your woman in control. Or the other case is, now it's a very sensitive one. The one that I'm going to give example of is like, if a 5-year child is get sexually abused in that age, maybe she would not understand what just happened to her. But then as she grow up, and maybe she gets to understand her body, maybe she gets to understand her rights, maybe she gets to understand what just happened, then maybe she would question why did it happen to her, and like, why did nobody care about it. So the first person she would usually go would be her mother. But because of in our society there is a norm that a woman carries the prestige of a family, then the mother might say, oh, just hush, hush, don't tell this to anybody. If people get to know about it, then they are going, like, the reputation of the family is in trouble. So just keep it with yourself, just ignore it. But how could she ignore that she was abused in such an early age? She knows that it went wrong, but how could she just tolerate it? And then she gets, the reactions would be again, and the anxiety, depression, confusions, shame, guilt, maybe guilt because people might, because a woman is considered, like, woman is the one who is responsible for the prestige or reputation of the family. She might feel guilty that, oh, she was not unable to, put things in place, or even sometimes, like, uh, people could blame her mother itself, that she did not take care. So because of all these social norms, where there are inequality, violence, or cultural tensions, social discriminations, like, untouchabilities, they are still there. Like, it's gone, there are laws, but still those untouchabilities are still there. And because of these, like, thoughts which are still there, even though the law does not agree, people get into trouble. I mean, those are the risk factors, and that might causes nightmares, worries, guilt. Somatic, what somatic is, a lot of people do not understand this, but there could be a person who is constantly ill, who might always complain that he or she has pain in her knees, in her body aches, he or she has headache or stomach ache, and he or she feels fatigue. So and you go for a checkup, like, what's going on, and you go for a checkup, you do some tests, and the only answer you would get is everything is normal, there's nothing wrong with your body. But the thing is, this problem still exists. So why does that problem exist? Is because our body has a mechanism to release stress. Okay, so just like when we feel very hot, we sweat. When we feel very cold, we maybe feel, we tremble, maybe we shake, right? So just like that, when there's extreme stress in your body and you cannot release it, sometimes it shows to our body, and at that time maybe different parts of our body ache, like maybe some people could get diarrhea, some people could get vomiting, some people get nausea. So all those things happen, and in many cases, like, some people could also go through conversions, which in most cases in Nepal people think it as possession by spirits. But that's also a mental illness, because they are going through so many things and they are not being able to express. So again, people might say, like, people go through ups and downs all their life, so what's the big deal? But the problem is, when these extremities factors, when they are exposed to risk factors for more than 2 weeks, there is a possibility that they are going to go through severe cases, and they will not be able to think straight. They might not be able to think that, okay, this is going on. They might not understand what's going on with them, and they might not understand what is the main reason they are going through all these thing. Or they can just say, oh, I did not feel like sleeping all night, but they might not know why. So to know these whys, like what happened, what is the core reason, you have to understand psychosocial problems. And for that, we have different management methods for psychosocial issues, and that's like providing psychosocial support and care, psychoeducations, seek expert if needed, and medications. So in all here, first I would talk about medications. I was talking about medicines a few minutes back when we first started, and one of our friend, Rambo John, he said, if medicines, do you recommend medicines? So yes, medicines are for the extreme levels. Like I said earlier, if you take medicines for your pressure, if you take medicines for your diabetes, why not for your mental health? Why question your mental health when it's about your mental health? It's so crucial, it's so important. And why not? Just like if you do not care your physical health, it could lead to, a very dangerous disease. Mental health is also similar, and if you do not take proper care, if you do not take necessary actions at right time, then it could lead to danger, like, the most and very common and very risky one that we all know is suicide. So when, like, there's a problem in you and it's not being solved, then people might think that suicide is the options. But I tell you that I've got to know from different resources that the people who think or who are suicidal, they do not want to die. They just want to get rid of the pain that they are going through. I once went through a person's story, and he was suicidal, and thankfully he survived. But what he said is, like, the moment he attempted suicide was the moment he realized that he actually did not want to die. All he wanted was the pain to end. So we don't want any of our we don't want to lose any of our friends or family members. So if we see it, the main thing is we need to check on them and see, like, what severe level, to what level are they uh, being affected by the issues, or to what level are they being affected by the health issues. um, Also, another example would be, you could get a fever, and some people would just get over it without even taking a pill or any medicines. But some people, if ignored, there are different kinds of fever too, and like typhoid, they have to take medicines, right? And I mean, if they do not get proper health treatment at right time, there are people who died of typhoid too. So it's not that all the mental health people are going to die of the mental health issues, but yes, we do need to take necessary actions whenever possible. So that's medication. So do not double judge, or doubt if medicines are the right choice. Of course, they could be addictive. Of course, there are side effects, but there are side effects for other medicines too. So if you're going through the problem, and if you think of going to a doctor, then if they do recommend medicines, yes, you should take it, and you should also stop it when they recommend it. Do not just leave it, oh, okay, I'm fine, and I can just end it. So no, we cannot do that. But with medicines, you have to do counseling and therapies too. Yes, the medicines only lessen the problem. It does not get rid of the problem. You have to get it rid from the problem. You have to go through counseling and therapies. So now, that's about medications. Next is psychosocial support. So what psychosocial support is, in a lot of cases, people go through such psychosocial issues because their basic needs, the basic needs are not being fulfilled. Like, people are in poverty and they cannot fulfill their basic needs. They cannot give food to their loved ones. They cannot fulfill the need of clothes. So they might have the guilt that they are not being able to fulfill all those needs. So in that case, just providing a basic service, the basic needs, or providing those services through different organizations who work for providing those needs, could help solve the issue a lot. Then the next would be community and family supports. For example, you might also get into a psychosocial issue, or you might have stress, for example, when your friend is not talking with you, so you are stressed that your friend is not talking with you, or you just broke up, and you just don't know how to deal with it. So in that case, many maybe like talking with other family members or talking with the friend itself, and giving the support by friends and group members or families could help a lot. So in that way also it could solve the problem. So that's the psychosocial interventions, like in the minor level. But then again, when their issues are very severe, like in depressions and anxiety, so in those cases, counselor is needed, or a psychologist, like in more targeted and focused way. Specialized supports are required. And then again, there's specialized services for the psychotic people, like specialist psychological or psychiatric care are required. So for that, I would like to give that what is psychotic is like when people do not have a different world than us. For example, for us it's normal that we could see, like we could only see normal human beings, right? But then there are people who could say, like they could see spirits or witches or devils trying to come and kill them. Or also sometimes not even see, but just like you are sitting there normally talking, and but then that people, the person who is affected, affected in a psychotic way, thinks that we are conspiring against him, trying to or planning a murder against him, and he feels unsafe. So in that case, there is a possibility that he would attack us, or he could be scared of us. So in those cases, there are such cases too, where people like I'm not going against the ghost spirits, but sometimes it might not be true. I don't know the truth, but there is a possibility that a lot of people are, they we don't see, but to them what they say is that a lot of people are there coming to kill them. And in that cases we cannot handle it, we just cannot handle it, because that's against our norm. And in that cases, specialist psychological or psychiatric care is required, and yeah, special care is required in those cases. So that's how this psychosocial pyramid works. And yeah, next is psychosocial intervention. This is also another way to manage psychosocial issues. In this, what psychosocial intervention does is um, it may not be able to get get rid of all the psychosocial issues, but it does not allow the psychosocial issue to get worsen. For example, a community sets a policy that each member of the family needs to be educated, or if not educated, be educated to at least 10th grade. So in that way, I think till 10th grade we are educated enough to understand a lot of our rights, rules, understand about our health. So when there is a basic education is given, then to a lot extent, many psychosocial risk factors could get reduced. There are situations when people do not understand that they are doing wrong, because they just don't know, they are uneducated, and they like it's not their fault that they do not understand it, because they are just not educated. So when we educate people on those things, it helps a lot. So that in that way we are at least helping people reduce the issue, then be increased. Another example that I learned it just recently is it is okay to express your feelings. I mean, in many cases we say like, what if he or she would not like what I just said? What if he or she would not agree to what I just said? But what if I'm just doubting? For example, you feel uncomfortable because of the way someone touches you, like even if it's just shaking hand. But then maybe it's normal for them in cultural way, like in many different countries they shake hands, they hug. But in our culture, even like touching is okay, but hugs are not okay in many cultures. So even when they are shaking hands, maybe I do not feel comfortable. So in that case, I am allowed to say that, okay, I'm not comfortable shaking hand with you. I'll just stay with the namaste, and I am allowed to express that. But in a lot of cases, we just don't express it, and we just, even if that person is touching you in a very wrong way, we do not express this, thinking maybe it is not what he meant. And in that way, sometimes we end up being abused, and that people just taking the benefit of lack of our knowledge. So so that is the kind of education, like this, it's an education that, what is okay and what is not okay. And so nowadays people are even trying to educate students in the early age about what is right touch and what is wrong touch. So that's a way, that's also one of the way to at least not let the community go through risk factors, or lead to some problems that could lead to the risk factors. And now finally, it's psychosocial counseling. And Lakpa, I just saw your comment, but I'll answer you in a minute. Let me just finish this. It's just one more slide, I guess. So the final one is psychosocial counseling. So when we think about counseling, people believe that it's generally giving advice. So when we say like, oh, counseling is just normal, you can just do like, you can just talk. So people think like, talk with me, why go to a counselor, just talk with me. But that's not how it is. It's not just giving, it's not just talking, it's not just listening, or taking advices, or listening. It's not like listening to a motivational speech either. But what a psychosocial counselor does is, he or she does not give you advice. Instead, they dig deep into your problems, like the root cause. Like I said, a psychosocial behavior is the result of the interaction between their internal and external environment. So they'll try to understand what kind of environment that person who is in need went through, what kind of internal environment he has, what kind of rules he had set up as a human, and what are the environment that he had to go through. So and there are lots of ways to go through, and there are exercises, different ways, and they reach to the root of the problem and try to resolve it in a way that the problem will not exist anymore, or and it's not just giving advice. Again, I would say that also sometimes, why we need to go to a counselor is sometimes we go there, and then suppose we go to our senior, maybe our family members, and they try to listen to us. But when we start talking, in most cases, what they do is they will start giving examples of their life, and they'll start talking about their issues. This is how I did it. This is what I went through. Like, we are there to understand, resolve our problems, not listen to theirs. And in many cases, like, even though they are trying to do it so that we could get motivated, yes, it's not that their fault, but in many cases, sometimes a client who is really depressed could get more depressed, thinking, okay, he went through so much and he did it fine, but why not me? Why am I not being able to do it? Why am I not being able to think the way he did? Or he might also think like, why am I so worthless that I'm not being able to think like that or think straight? So that way he or she might gonna feel more depressed or more worthless. So a counselor are more professional, or they have understood those things, and they try not to lead the client to that position. The number one rule for a counselor is do no harm, knowingly or unknowingly. So they are professionals in doing so. So some of the benefits of psychosocial counseling is there will be less anxiety, greater self-confidence. Yes, they do help us increase our self-esteem, better relationships, to how to deal with people. Maybe we don't know how to speak. Maybe, I mean, we have thoughts, but we don't know how to put them in words. Like, we could be just straightforward, and because of the way we speak, people would get offended, and because of that, we are so scared to speak up our mind. And when we do not express ourselves, a lot of time we get into psychosocial problems. Like, a lot of times psychosocial problems are also because we do not express, we are not being able to express it, and there are lack of confidence in it. So yes, a counselor would help build all those things. Regain emotional balance, increase assertiveness, stress relief through different exercises and therapies, ability to set boundaries. Like, sometimes we just help people a lot because that's how we are um, taught, how we are brought up. But then there are people who just take help, but they do not give back. And in the process of giving up, we end up being drained to a level that we cannot give anymore, and then we are just left alone and drained and in problem. So a counselor would help you set the boundaries. Like, if you want to help, you could help, but there are certain limits to that help. You cannot help those people who would not you know appreciate, at least, or who would not appreciate your help, or things like that. And then trauma resolutions and all that. These are the ways a counselor would benefit you. And that is it. And now I would answer the question. Lakpa Chamji Sherpa said, how do we intervene in such cases when someone is going on downward spiral and doesn't want help, like pushing everyone away? um yes, that's the case when, like, they feel like nobody understand them, um and like, they are so fed up that they do not want help at all. They just feel like, okay, they are worthless, maybe. So in that case, there are people who would think like that. First thing would be like, maybe just listen to them for like, say nothing, but just listen. Like, hey, I don't. I mean, you might think that I do not understand your problem. Like, maybe I don't, but I do care for you. I want you to feel good, and like, you could talk to me if possible, but if not, that's fine. But if you need help, in any cases, I'm here with you. And like, just telling them that I'm here with you and not judging them also helps a lot. And in cases, sometimes they might open up slowly. um but yeah, mental health is such a mental health issues are like very requires a lot of patience. So yeah. um did I answer your question, Lakpa? um so if you want to help your friend, first thing is try to listen to them without any judgment. Like I said, people often try to give examples of their life, or someone who was a failure. For example, sometimes, when someone fails, the most common example nowadays is like Mark Zuckerberg was a failure, and he now has like everything. Yeah, sure, Lakpa. um he because of him now we have this social media, and like because of him we are all now connected to um, one like a small world. But then the person who is going through a depression maybe feel like, okay, he was ambitious though, I'm not ambitious. Maybe he has lost his ambitions during the process of depression, and he doesn't feel like doing anything at all. And that is also a problem. Like, he or she does not want to do anything at all. He doesn't know what to do. He doesn't want to be like Mark Zuckerberg. And maybe when he sees, when people give example of Mark Zuckerberg, maybe he doesn't like it because he is in that state. And we have to understand that he is going through some difficult time. Not that, how could you think like that? If we ask them how could you, then they might not feel okay to share or open up with you, and end up, you know not sharing things with you. So be non-judgmental as much as possible. Yes, Lakpa, please. You had another question. Mm. What about the person who is trying to help? How to stay motivated to help, because it can get really draining. Yes, it is true when you're trying to help someone, and you're trying yourself, but you are not a professional, right? So um, it could, like, you're trying, and what could happen is, like, you and your friend are struggling, and your friend might see that you are trying hard but you are not being of help. And in that cases also, sometimes the client or the person who is suffering could feel that, they are being trouble to you, and make you feel, um, make them feel that they are so bad. um, so the best thing would be, um, say, like, maybe I'm not being of help to you, and maybe we could go to seek help. But I am with you, and it's going to take time. You have to say that, um, so you being drained is could, worsen the situation, because both your mental health is important. So trying to help him, you could be so drained that you could be in that situation again. So for that, you have to learn some techniques, I would say, um, for refreshments. I mean, get more motivations yourself, and then slowly, just like I said, listen to him and try to convince him that he or she needs to get help. And if not, just try to listen to them more than anything. Listening is the best option we could do as a friend or family, and not be judgmental, like not judge them, how could they think like that, or why do they think like that. Sometimes asking them questions like, how could you, or why are you thinking like that, why are you like this, could make them feel bad, more bad. Like, they don't know why are they feeling like that. They don't know how or where these problems are coming from. In many cases, it could happen that they just don't understand it, and they're trying to understand it themselves. But when we, as a friend, try to help them and say, like, why, maybe they just don't know the answer. So yeah, just try to listen to them and try to get them convinced that they need to go see a specialist. And yes, we cannot be a counselor until and unless you have taken the trainings or learned the special skills. uh, we are not counselors and it will drain us, so we cannot be the counselor. You either have to learn the techniques to get regain your energy, um, but yeah, as a friend, all we could do is listen and be non-judgmental. Yeah, thank you for your question. I don't know if it really helped though. Any more questions from anyone? So, thank you then. Yeah. Thank you. So, yeah, I think that is it. Finally, I would like to thank everyone who were there listening to me all this while. And thank you, Nirzala ma'am and Vijaya ma'am, for your constant support and guidance. They are my um, constantly supporting me. And last time I did mention Nirzala ma'am's name wrong, so I'm really sorry for that again. Yeah, that is it. So if there's any question, I'll wait maybe one more minute, and if not, then that is it for today. Thank you all for listening to me all this time and for your questions. um, I hope they are going to help others as well, and I hope this was a very helpful session, I would say. uh, I think that is it then. Okay, thank you very much. You all have a wonderful night. Thank you and have a good night.